Good morning to all. This is Ranjit Sahu, Head of Marketing with Motivational. Welcome you all to the very beautiful series of Prerna 8 part, wherein we have eminent IMS members across the country have joined in a very beautiful topic when I talk about that mindful well-being, which will be spoken by Dr. Nirali Pandit and followed by Kegel exercises for pelvic floor standing by Dr. Komal Saha. With this, I hand over the session to Nirja ma'am to take it forward. Over to you, ma'am.
Good morning, everyone. So this is a very, very warm welcome to all of you who have joined us for Prerna and who are our very loyal followers. Prerna is now 8 episodes old. This program is held every second Sunday, second and fourth. It's a brainchild of our current IMS president, Dr. Pushpa Sethi, and the secretary, Dr. Arti, and Dr. Shobha, Gudi, and I are the conveners for this program. The main idea is to have one motivational talk and one thing on exercise, because fitness has no age. Get up and move. And you can do that if you're physically fit and mentally fit. So we have both aspects covered. We do not ignore the mental health part also. And this program is also held in collaboration with the Inner Wheel Club. So I'm very happy to have them collaborate with us, because on a previous occasion, when we did collaborate, they actually organized the HPV vaccination of more than 100 slum girls, which was an amazing thing. So it's a very warm welcome for them too. And so our first speaker is Dr. Nirali Pandit. She's a certified positive psychology coach. And
Nirja, can I just ask, say good morning to Dr. Pushpa Sethi? I had not wished the president. Hello. Good morning, Dr. Pushpa.
Yeah, very good morning to all of you.
Yeah. So we will be proceeding, madam. With,
Yeah, Dr. Pushpa, I'm glad that you are here. Can you possibly introduce the first speaker? Dr. Pushpa is our president, Indian Menopause Society.
Before I introduce the first speaker, I'm really happy to know that you're collaborating with the Inner Wheel Club, because I'm a very, very active and a very old Rotarian. And we do a lot of similar work because we stand on the same ground, the Inner Wheel and the Rotary. The Inner Wheel is the women's organization of the Rotary. And we have been taking up, immunization, HPV immunization of girls of the lower strata in a absolute, a very, very strong way. In this year, we have talked to the Sarvavac people and they have given us good concessions. So they have given us good concessions, and we have, a big target to achieve this year of HPV vaccination of the girls who cannot afford it. So I was very happy to listen to that, and I thought I would just make a passing comment on that ground.
Great. That's great. Thank you so much. Yeah, please.
Dr. Pushpa, would you like to introduce the first speaker?
Yeah, so our first speaker today is Dr. Nirali, and I was just going through her, CV. She's founder Echo Me, an initiative to empower and flourish people through channels of coaching. Adjunct professor at Ahmedabad University at the area of organizational behavior. Her expertise lies in corporate training, organizational coaching, and individual personal coaching. She runs workshops and training programs related to creating a strength-based mindset, building high work engagement, good decision-making, teamwork, effective communication, emotional and social intelligence, dealing with reducing procrastination, etc. She looks forward to contribute to community and society as a passionate positive psychology practitioner and well-being coach. So there's I have come across so many well-being coaches. In fact, one of my Rotarian friends is a well-being coach, and she gave me a few classes just on the side. And I tell you, this really makes a lot of difference. And so this is a very upcoming and a very important field these days, because everybody requires, I think, some sort of guidance through the difficult pathways of life. So welcome, Dr. Nirali. Looking forward to your talk.
Thank you so much.
The topic of your talk, Dr. Nirali Pandit, is mindful well-being.
And if I may say so, Nirja, since you have sourced this faculty, whether you would like to say a few words before she starts.
No, I think we are good.
We'll do it at the end. Thank you.
Yeah.
We are ready to start. You can start your presentation.
I can start my presentation. Thank you so much, Dr. Pushpa Sethi, Dr. Nirja Chawla, Dr. Shobha, and the entire team who has given me this golden opportunity to reach out to people with the subject that I'm really passionate about. Thank you so much. So here I go. Are you able to see the slide? If one of you...
Yes, we can.
Right. So without wasting much time, I'll jump straight away to the topic. One of the most important events for women in midlife is menopause. Now, there is no exact age or time as to when it's going to strike, but surprisingly, when it comes in the most dramatic way and only leaves you for reactions. But women who are mothers of Gen Zs today, they are expected not to react, but to respond. They're expected to prepare themselves, and they act and they come out triumphant. So if you are also one of those Gen Z moms, and if you are looking forward to this triumphant exit, then let's know more about what happens in menopause. The thing is, there are 40 plus kind of changes or symptoms that we can see when women go through menopause. And you can see here that out of these 40 plus symptoms, there are only 6 or 7 symptoms which are emotional or related to the mind. Remaining all are physical. And I would like to bring to your notice that these very few handful of symptoms, which are mental symptoms, they create a huge havoc in a person's life. The impact that these emotional symptoms have, they actually deal with your daily life issues like loss of self-esteem, loss of confidence, indecisiveness. Maximum women, they resign during their menopausal phase. So these issues, which look like a very daily issue, they actually create a lot of havoc in a person's life, because these daily issues, and the thing is that these daily issues are not so grave that a person rushes to the psychiatrist for help. And at the same time, if they are ignored, then there are all chances that a person gradually slips into depression. Now, claiming and accepting that one has depression is still a stigma and a shame factor across the globe, not just in urban Indian middle class. So then why not handle this delicate matter well in time, while you are still going through these daily small issues, and even before it arises to the extent that it becomes very depressogenic and needs proper medical help. Now, because this is a forum which is related to gynecologies and medical forum, I would just bring one angle to it, that how can a gynecologist help? The options that can be offered to patients, or because it's a mixed crowd and there are people who are non-medicos and women, so how can they take help? So the first thing that they would like to do is they would like to go to the gynecologist. So how does this help come in place? Either you can have HRT offered, or you are given oral medication, or you're given supplements like calcium, multivitamin, so many other supplements. You are advised to join a community. It could be online community, it could be offline community, where you have more self-awareness and you know exactly what's happening, and you end up addressing symptoms. Like if I have insomnia, the doctor can help me to address that symptom of insomnia. But can there be any holistic, a very wholesome solution to what's going on in your life, where you're also dealing with relationships, you're also dealing with your children, you're also dealing with your work, you're also dealing with your productivity, your I would say your mood swings. So what is that solution? I suggest that coaching and counseling can be one of the solutions that can be offered by gynecologists formally, and even people can ask for this solution or this service from gynecologists very openly. So having said that, let's say if you want to understand what kind of help can positive psychologists offer, then basically it is minding your mind. And in order to understand how to mind your mind, I would like to take a peek into neuroplasticity. Now, the thing is that our brain, we all know that our brain is made up of neurons, and when a signal travels down a neuron, it basically results in activation of other neurons based on synapses that connect the neurons. So there are multiple choices for that signal to go to, and it decides which direction the signal wants to travel. But the question is here not which signal which direction it wants to travel, but which neuron will get activated. Every time a neuron gets activated, it activates another neuron, and they become very closely wired together, making it more likely that the signal will go in that direction the next time around. And this basically constitutes a neural pathway. So as you can see that here, if there is, I would just bring an example over here, that if you're creating a neural pathway of your choice, then that neural pathway stays with you. And you can see that here in the top of the figure, there is a saboteur. Now this saboteur is basically your habits, you know, your I would say your thoughts, your actions, your daily habits, your emotions. So when an external event takes place in your life, basically this saboteur gets activated, and it takes, or it gives attention to some past bad event or that has taken place in your life, and then you have all negative thoughts, you feel negative, and you react negatively. So for instance, if you have asked your team to follow your instruction and do things your way, but they do not do it, and now this might draw your attention to some past event in which things did not go your way, and you had to face some negative repercussions. So you start becoming very anxious and stressed out, and you see the importance of control in your life. Now, what is this control? Control is basically a saboteur. And now it's okay to control the controllable, but this habit of controlling makes you have control even over the uncontrollable. So to survive and succeed, the saboteur is going to tell you that I should have more control if I want to succeed. If I want to be productive, if I want results, I should have more control. And the saboteur will keep you having more control, which will actually create a neural pathway of you becoming a very controlling person. So momentarily, it might give you good results, but over a period of time, you will start experiencing people running away from you, people not finding you approachable, people not finding you empathizing. And why? Because you come across as a very controlling person. So this is one example that I've given you. There are various saboteurs, like there would be people who feel stress and anxiety because they have this fear of feeling judged. They get into self-doubt, and that self-doubt neuron activates another neuron which instigates to self-doubt, and you get annoyed, you get angry, you start avoiding people. You start procrastinating because you're not sure about your confidence and your image in the work that you're going to do. And then there is discontent in life. So it's up to you that which neural pathway you want to choose to develop. So my proposition here is that repeated positive thoughts create space for positive emotions and positive habits, and thus positive life outcomes. So if you choose to attack or disregard the saboteur at the first level itself and you dismiss it, you say, no, it is, I don't have to control. Let me be more empathetic about what my team members want to tell me. Let me be more participative in my approach. Maybe I might get a new idea. So ultimately, if you start thinking in a positive way, you are that neuron is going to fire another positive neuron, and it's going to make a neural pathway, which is going to be a very neural, which is going to be a positive pathway. So these repeated thoughts, positive actions actually become your positive habits, and you see a very sustained positive change in your life. Something that we all want to have, something that we all are looking for. So there are many such examples to create this kind of a positive neural pathway. I'll give you a small example of Pankaj Tripathi, a very popular actor in Bollywood and even on small screen. I remember in one of these interviews, he's saying that when I was small and I did not want to study, I requested my dad to give me a tractor. When he explored the cost of the tractor, he realized that we can't afford it. And he said, no, I'm sorry, you have to continue studying because you can't afford this tractor. And his entire world came to an end. It all shattered in his life. He realized that I'll have to actually now study. He studied, he went out, he explored places, and today he's what he is. And had he not allowed that change to happen in life, had he got the tractor, he would be doing farming. He would have been a farmer today in some unknown village of India. In comparison to what he is today, we all know what he is today. So why positive psychology? Why this entire concept of changing your mind for positive thoughts, positive emotions, and positive actions? See, we all have saboteurs, which we have to keep checking into all the time. There are other therapies and there are other modalities which actually help you deal with those saboteurs. It could be anger, it could be anxiety, it could be self-doubt. There are many ways in which you can deal with these saboteurs. But it is about dealing with negative emotions through the lens of positive psychology and not through other lenses. Why? Because through other lenses, when you end up focusing too much on the negative emotions, you end up dwelling in those negative emotions to sit and analyze why they happen, what is the trigger point, how is it that they are not helping us, how is it that they are helping us, and too much of analysis elongates your suffering. Whereas positive psychology coaching dismisses the suffering aspect and takes this 1 second of activated awareness that, okay, this is a negative emotion. Yes, it's lying to me about my successful and flourishing in life. Let me allow it to go and let me think positively. So moment you have that awareness that this saboteur is actually not helping me, in the long run, it's going to be my enemy, you start targeting that saboteur at that point of time itself, and you switch over your thought processes to positive thinking about possibilities, rather than analysis about why the saboteur has come to me, right? So this possibility thinking attitude through positive psychology coaching can actually help you reach your full potential, help you to thrive and flourish in life. Of course, the thing is that this attitude has to be embedded in your daily life. So what positive psychology interventions generally, which are popular one and help in a person's daily life, even to independently deal with saboteurs, is strengths, positive emotions, happy hormones, social well-being. Quickly, if we put the focus on happy hormones, because remaining 3 will be quite interlinked. If we put our focus or our lens under the happy hormones, I strongly believe that it takes 1 second for the cortisol to fire. And that 1 second of event actually ruins your whole day for 8 hours. That bad mood, that negative emotion dwells with you for 8 hours. And what if those 8 hours are the most productive hours of your day. How would you feel about it? Miserable. And then at the 8 hours, at the end of 8 hours, you feel that, oh, I've lost my entire day. I don't know what to do about it. And then you still, you get into this loop of regretting, feeling guilty, feeling miserable about it, and you're still dwelling in those negative emotions. So how do you combat or disregard this firing of cortisol? You actually you increase the dose of positive psychology interventions. So what I mean by dose is dopamine, oxytocin, serotonin, and endorphin. And this is going to be happening very commonly for all those people who go through menopause, who go through andropause, and even in other aspects of life, because of course things have changed. We have too many nuclear families nowadays. Loneliness is the new pandemic. So there are many other reasons as to why not just andropause and menopause, but there are many other social reasons why people need to deal with that cortisol negative emotion, negative emotion. So let's take a couple of examples here. Let's say dopamine. Dopamine is a reward hormone. What happens in my daily life? For instance, all of a sudden I feel that a person who's been in power, in position, has led a team of even 20 people. Today I feel all of a sudden I feel indecisive. I don't know what's going wrong with me. Somewhere I know that this is my perimenopausal phase and something is going wrong with the hormone. So do I address my hormone with the answer in hormone itself? Do I take care of my dopamine? Yes. Dopamine is a reward hormone. So what is it that I need to focus on? I need to focus my long-term goals into small-term goals. I need to change my habits to positive habits. I need to go around it in a very planned way, where positive psychology tools and techniques, they help me to balance my dopamine by regulating my daily life. And once I start doing that, all of a sudden, I see that I start getting positive feedback for my daily life routine. Why? Because somewhere when I've started working on my perseverance, I've started working on my positive habits, I've started working on my short-term goals, which are inching towards my long-term goals, I'm already feeling rewarded from inside. It started balancing my dopamine, and I feel better with the decisions that I'm taking with my current life affairs. So this dopamine release is actually, or balance is actually making me a better person, better decision maker, and that's giving me a lot of positive feedback, reward, and recognition. On the other hand, if I talk about, for instance, serotonin actually helps when there is a balanced serotonin, it actually increases your willpower. If I talk about endorphin actually helps you if you use techniques like mindfulness in your daily life. It actually activates your self-commanding muscle. Self-commanding muscle helps you to remain self-regulated. Mindfulness is commanding your mind to do something and following your command rather than emotions commanding you. So commanding the mind to stop sabotaging, and instead of sabotaging, to do something positive, instead of allowing the mind to slip into negatives automatically, is giving you a lot of pleasure and self-love. So when all these hormones are balanced in your body or in your brain, what happens is that somewhere cortisol doesn't have a high role to play, and it gives you a better daily life, which makes you feel much better than dwelling into anxiety, stress, self-loathing, and so many other things. This entire method of positive psychology coaching, it gives you very beautiful outcomes in the longer run. It gives you a positive self. Why? Because you end up focusing on strengths and characteristics of being a good person. It brings about a constant positive change or a long-term positive change in your life, because you commit to a good life. You start functioning at a very optimum level. You start seeing the best function of yourself, best version of yourself, and somewhere you are using your full potential that you have not tapped into until now. So you see a lot of positive change because you saw scope of changing, scope of functioning at an optimum level, scope of probably being your best version. So there is a lot of sustained positive change in your life. You end up this positive psychology coaching ends up evoking awareness in you. There are so many times where you have been facing a blind spot. There are people who are pretty aware, who are very clear, but then there are people who are not sure about what they want to do in life. They are not sure where they are and what is their purpose of life. So these interventions, they help you to evoke awareness and become more clear and knowledgeable about yourself. It leads to authentic happiness. Like I just said, that at the age of 40, at the age of 45, when you've been in a mad rush, in that rut of life, all of a sudden you feel that I'm not living a purposeful life. I'm not living a meaningful life. My life or my soul is not aligned to that purpose. I'm not happy. I don't know what am I doing. I've been doing so much and then I'm still not happy. It means that I'm not living a very meaningful day. So then one needs to peek into the self and see what is meaningfulness for them, which will take away their emptiness, which will take away their worthlessness. What is being truly engaged for them? So it is not necessary that you can remain engaged only in a profession. You can remain engaged in your family life and feel completely fulfilled. And you end up having a very pleasurable life. For example, I've been a hairdresser. I don't enjoy doing nails. I don't enjoy doing makeup, but I enjoy learning the hairdressing trends that are going across the world, and I want to bring them to my salon. And that gives me authentic happiness because it gives me some kind of pure engagement that I haven't felt until now, because I was doing all the work that did not give me pleasure, did not give me purpose. So it could be for anyone. It is not for some particular section of people who are high on awareness. It is for each and every one of us. You develop an optimistic mindset. Believe me, optimistic mindset people come across as very attractive and very charming. They encompass more positive experiences across their past, present, and future. They see the reason behind an event to happen, and they see that event, even that negative event, as a gift and as an opportunity. As a gift and as an opportunity to grow in life, to build more positive experiences in life. It actually broadens your perspective and builds a better life. And while I'm talking about building a better life, it actually keeps on building your abilities for a better life. There is no ceiling to building abilities for a better life. It is like an endless journey where you keep going from 0 to 0 plus. And this journey from 0 to 0 plus is something that we all desire deep down. It is something that we all can have more than desire. We can all have. It's all about making opportunity of positive psychology coaching. I'm more than happy to take any questions.
Dr. Nirali, that was really, really amazing. What I was realizing that at the outset, I had thought everybody knows about positive mindset. Why do we need to have somebody talk about it? And after your talk, I realized that we actually need somebody to keep knocking it into us, because we do need help. We do need that coaching. We do need to understand that about neural pathways. And one thing that I learned from yoga was all the time they talk about break the pattern. Yeah. So whenever you do passive stretches or you do something 10% beyond that, you're actually changing your muscle memory, you're changing your pattern, and you're making a deliberate effort to do something that you are not.
Yes, absolutely.
And I personally feel that to be able to dismiss the saboteur, what you need is, like you said, actually, you brought it to me, that you need to be able to watch your emotions. And to watch one's emotions, actually, one has to practice daily. For example, if I pick up this pen, then I should know. Can we remove this slide, please?
Yeah, sure, please. Should I stop sharing?
Yes, please.
Thank you.
So suppose I pick up this pen because now I can see myself. So if I pick up this pen and if I do this, then I should be aware that my right hand is doing this and my left hand is in this spatial area. So if you're able to be aware of every little action that you do, you're driving a car, how is your hands placed on that? You look here, you look here. We are aware of every physical action, then you are able to be aware of every mental thought that crosses through your mind. So when you say that dismiss the saboteur, I totally agree with you, because you have to learn how to dismiss that negative and say, this is the path I don't want to go through. So that was excellent. And I also think that positive mindset is very attractive to people. They don't like people who are negative. So, do we have any questions? We don't have any questions.
I think what you say is very true, Nirja, that especially in our profession, when there is an interface, we live through interfaces the moment we get up in the morning. First, it's the family, then it is the hospital staff, then finally it is the patients, and then we have a whole lot of the next generation following us around, looking up to us to teach them something. All of us are in that zone. And I think when it comes to interface, as Nirja has said, from our perspective, situational awareness should be at its peak. And you have taught us today how to maximize the output, having, the vibes coming out from our body language to others will also improve. And I mean, it will be radiant. What goes through the mind reflects in our body language is what I have always believed, as well as the words we choose to speak and the tone with which we speak them. And I'm talking about mainly about interface and day-to-day and minute-to-minute living. And I think all of us as very keen professionals have short-term and long-term goals. But what you have made very brilliantly, you have brought out what we can do every minute of our day. So thank you for that, Nirali.
Yeah, Dr. Nirali.
I think this era of jet setting and multitasking and life where you actually at times really do not get time for yourself, and there is so much on your brain all the time, on your mind all the time. I have experienced. I told you I had a couple of classes my friend gave me. She's a life coach, and she goes to schools. Gives these classes to children, even to children, to class teachers, to professionals, companies. So she gave me so I tell you, I picked up a few points which I still practice, and they really give you a positivity. They sort of help you to reach your goal in a more positive manner. We all have our goals. It's not that we've finished our goals in life or we have practiced 40 years or 30 years and so we have no goals left. We all have our goals as long as we are there, as long as we have the energy to achieve them. So it really helps you, shows you the pathway, how you can reach there. And I'm sure Nirali will agree with me. I think all of us, if we can have that a little bit of help, it really goes a long way in giving you
Yes.
a good direction.
Yeah, definitely. We all think we know about positive mindset,
Yeah.
but we need a proper coach to remind us
Yes, exactly.
that this is what it is. And I'm reminded of a story I really want to share with you. I used to have somebody whom I used to consider like my guru, and his wife. So for everything, she would laugh. So one day she told me, oh, my Ashok, he dropped my dinner set, it broke. And she laughed. And for a very long time, I couldn't understand why she behaves like this. And as I'm listening to Dr. Nirali, I am realizing that actually she was practicing a positive mindset and lightening her own system. She was protecting her own system by being negative, the diseases that come from the negativity. So I really loved that. So thank you very much, Nirali.
Thank you so much. I'm so glad that I got this opportunity. I just want to, like, if I have a minute or
Yes,
half
yes,
a minute,
please.
I just want to thank you all that you actually made me think about this topic, mindful, mindful well-being, because mindful is all related to, like what Dr. Pushpa Sethi said, that there is awareness, and that conscious well-being practice is very important. Otherwise, we all feel that we are optimistic, we are doing great. I mean, it's okay, thoda bahut negative chalta hai. But no, it is about being consciously, mindfully positive, or I would say, think about your well-being. Thinking about possibilities, thinking about the gift and opportunity that a negative event brings along. Like you said, ki wo dinner set toot gaya. So the gifts and opportunities that a negative event brings along, the moment you have that click of shift, then you are just saying absolutely no to saboteur. No, you're lying that my maid is not good, she's not efficient. It is basically, I need a better gift set, I need a better dinner set. It is a very conscious effort which comes with daily practice, and which comes with embedding this daily practice in your daily life.
Yes, cheers.